Changes are coming to trauma and cardiac services that are offered by one of Sioux City's 2 hospitals. Right now, MercyOne Siouxland Medical Center is a level 2 trauma center, but MercyOne has announced plans to drop to a level 3 trauma center and also pause some of its cardiac services. The announcement was sent to MercyOne Siouxland employees and providers on Thursday. We got the details in an email from Tom Clark, MercyOne's president overseeing Western Iowa. He said the changes include pausing provision of cardiac surgery services for the foreseeable future. That includes a pause in MercyOne's open heart surgical program. But Clark says MercyOne will continue to provide comprehensive diagnostic and interventional cardiac services. Clark also says MercyOne will change its trauma designation from a level 2 program to a level 3 program. MercyOne says it will continue to provide trauma care in its emergency room and will transport patients to a higher level of trauma care if it's needed. MercyOne says the changes came for several reasons. It includes changing demographics, continued difficulty in recruiting providers, the transition of inpatient services to ambulatory settings, and changes in the economics of health care. MercyOne also pointed to a change in the requirements for maintaining a level 2 trauma center set by the American College of Surgeons. But MercyOne didn't elaborate on those changes. As a result, MercyOne Siouxland Medical Center's emergency department will change from a level 2 to a level 3 pending a state survey. Those changes will also cost some MercyOne employees their jobs. MercyOne maintains it will be a small number of employees, but again, did not elaborate. When MercyOne lowers its trauma designation from level 2 to level 3, that will leave a handful of level 1 and 2 trauma centers in the 3 Siouxland states. The nearest centers in Iowa are MercyOne Des Moines Medical Center and Unity Point Health Iowa Methodist Medical Center, also in Des Moines. In Nebraska, there are level 1 trauma centers at Nebraska Medicine and CHI Health Creighton University Medical Center Bergen-Mercy in Omaha. And in South Dakota, there's a level 1 trauma center in Sioux Falls at Sanford USD Medical Center, and also in Sioux Falls, a level 2 trauma center at Avera McKinnon Hospital and University Medical Center. Our team coverage continues now with Jessica Bowman. She joins us in studio with more on the change. Jessica?
And as the story continues to develop, of course, we want to know the difference between a level 2 trauma center and a level 3 trauma center. Joining us tonight to break this down, Sue Prentice, the executive director from the American Trauma Society. Ms. Prentice, thanks for joining us. So let's go ahead and get straight to it. What is the general difference between a level 2 and a level 3 trauma center?
Thank you for having me. So the differences are going to be about the types of services, specialty care services that you provide, and how often in terms of hours that these have to be available. So we'll talk in generalities across the country. A level 2 trauma center would be able to care for patients who have sustained a traumatic head injury. They would have to provide that availability 24 hours a day. They also are going to have higher levels of requirements for call time, for access to anesthesia care, as well as something we call interventional radiology, which is entering different parts of the body through vessels to fix problems versus taking people to the operating room. So those are the large differences in, clinical care between the level 2 requiring those and level 3 not requiring them, but the level 3 would have to have. If they're not required, they're not a level 2 anymore or have never been a level 2, they have to have a plan for if they have patients who require that higher level, how to move them to that level of care, regardless of where it is in your state, which would be the next closest facility that can provide it.
Sue Prentice, executive director from the American Trauma Society. Thanks so much for joining us and providing that information.
The rules for level 3 trauma centers will fall under the state's administrative code, which is managed by the state's Department of Health in conjunction with hospital leaders. Now, when it comes to choosing which trauma center first responders take a patient to, there is a state protocol that they have to follow. KTIV's community impact reporter Taylor Deckert joins us in studio now with more on the protocol and how this impacts EMS providers. Taylor?
The goal of everyone involved in an emergency is to take care of the patient. Sioux City follows the state's out-of-hospital trauma triage destination decision protocol. Now, this requires first responders to transport the patient to the nearest appropriate highest level trauma care facility. Now, Sioux City's EMS director says they estimate 15 to 30% of calls are trauma related. Previously, most trauma injuries were going to MercyOne due to their higher level of care. With this change, patients can choose where they want to go now, if they choose to do so, because Unity Point and Mercy are now at the same level. The first responders can now choose the closest facility as well, getting them the urgent care.
We have a call that we're going to.
Everything stops when the tones ring.
It's not going to really shake up the way ambulances transport, other than the destination guidelines. We'll be able to take people to the closest facility rather than bypass a hospital to take them to a level 2 trauma center.
An instance where this is not the case is for MASH casualties, where they'll always go to the closest hospital. Once patients are at that nearest hospital, it's up to the hospital staff to determine if a higher care of level, like level 2 or level 1, is needed. Matt?
KTIV's Taylor Deckard in studio for us tonight. Taylor, thank you. Sioux City Mayor Bob Scott released a statement with the city's response to MercyOne's changes. He said, quote, "The city of Sioux City is concerned about the recent news from MercyOne and the impact it will have on quality health care in our community. The city has just learned about this news and hopes to meet with representatives from MercyOne soon to further discuss the changes," end quote.